Sudden cardiac arrest claims the lives of over 460,000 each year. The truth is that only 1 out of every 30 cardiac arrest patient receives interventional medical treatment that saves their life. Hi, my name is Gary Workman, and I would like to demonstrate for you today one of those interventional medical treatments. It is called the artificial external defibrillator, or AED. Now, artificial defibrillators have been around for many of years. Created in the late 1800s, doctors and scientists discovered that whenever a patient's heart stops, it could be revived to a normal heart rhythm by using a controlled electrical shock. Now, the machines that were used to administer these electrical shocks were usually bulky and only located in medical facilities, and only to be used by trained medical professionals. But with the advancements in medical technology, the automatic external defibrillator was created. The difference between the machines of old and the new automatic external defibrillators is that the automatic feature uses a computer to give voice commands to the user while the emergency is in process. Today we're going to demonstrate this unit. It is the PowerHeart AED G3. So let's start. In the event of an emergency, the first thing that you should do is dial 911 or have someone else dial 911. Locate one of these visible units, usually well signed in populated areas. You may see them in your workplace, in school, grocery stores, airports. They're located in many populated areas these days. But once you locate it, open up the case, locate it near the patient, and open it for the voice commands to start. Let's start the process and let's listen to see how easy the instructions are to follow.
Stay calm. Follow these voice instructions. Make sure 911 is called now.
Call 911.
Begin by exposing patient's bare chest and torso.
Expose the
Remove or
chest.
cut clothing if needed. When patient's chest and torso are exposed, remove square foil package from lid of AED.
Remove the foil pack.
Tear open foil package across dotted line and remove pads.
Remove the
Next,
pads.
separate one of the white pads completely from blue plastic liner. Begin peeling from the tabbed corner. Firmly place the pad without the liner on the patient exactly as illustrated. This pad can be placed on either of the 2 locations shown. Next, peel the blue plastic liner off of the second white pad. Firmly place the second pad on the opposite location, exactly as illustrated.
Now, for today's demonstration purpose, I wanted you to hear how easy the follow-up instructions are. Now that the pads are in place, the automatic exterior defibrillator will automatically register the vital signs of the patient. This is important for 2 reasons. Number 1, it will advise you what the next step should be. And number 2, it prevents an accidental electrical shock to the patient. The only way an electrical shock is administered is if the vital signs show that one needs to be. The next step is to listen and follow through the instructions, which may have you give CPR. Now, if you have not taken a CPR training class, it is this easy. The command prompts you to put your hand between the chest area on top of the heart. It tells you to put your next hand on top of that hand and to press firmly. It then commands you to press down with the heart rhythm Now, if you do not know how often or when you should press, the commands tell you that also. It will sound something like press, 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 and it will continue for around 30 seconds until the monitor reads that the patient no longer needs CPR or should have an electrical shock delivered. It is that easy to follow the instructions of the AED. Next, always remain with the patient until medical responders arrive. Once they arrive, the AED actually has a visual prompted screen that has the vital signs of the patient already for them. This will help them to assess the patient and prepare them for the next step. That is how easy it is to save a life. Thank you for listening to my demonstration today.